Hello, people. Today we are here talking about a bad bitch, influenza. It is a contagious respiratory illness caused by influenza viruses that infect the nose, throat, and sometimes the lungs. If you have these symptoms, well, you have flu. You have fever or feeling feverish chills, cough, sore throat, runny or stuffy nose, muscle or body aches, headaches, fatigue. Some people may have vomiting and diarrhea, though this is more common in children than adults. Attention, this virus can be dangerous. How? Wait, I'll teach you, honey, but influenza can cause severe illness or death.
You what?
Especially in people at high risk like pregnant women, children under 59 months, age more than 65, individuals with chronic medical conditions such as chronic cardiac, pulmonary, renal, metabolic, neurodevelopmental, liver or hematologic diseases, individuals with immunosuppressive conditions such as IF, receiving chemotherapy or steroids or malignancy. Healthcare workers are at high risk acquiring influenza virus infection due to increased exposure. It's time to talk about relation of number and disease. Worldwide, these annual epidemics are estimated to result in about 3 to 5 million cases of severe illness and about 290,000 to 650,000 respiratory deaths. Hi! Human, tell me, how do you think the flu spreads? Most experts believe that flu viruses spread mainly by tiny droplets made when people with flu cough, sneeze, or talk. These droplets can land in the mouths or noses of people who are nearby. Less often, a person might get the flu by touching a surface or object that has the flu virus on it and then touching their mouth, nose, or possibly their eyes. How to find that we are sick? For diagnosing, we use these methods. Laboratory confirmation of influenza virus from throat, nasal and nasopharyngeal secretions or tracheal aspirate or washings is commonly performed using direct antigen detection, virus isolation, or detection of influenza-specific RNA by reverse transcriptase polymerase chain reaction. Rapid influenza diagnostic tests are used in clinical settings, but they have lower sensitivity compared to RT-PCR methods, and their reliability depends largely on the conditions under which they are used. Influenza, COVID-19, and the common cold all are contagious respiratory illnesses, and they have many similar symptoms, but they are caused by different viruses. The most important thing is preventing seasonal flu. The first and most important step in preventing flu is to get a flu vaccine each year. The flu vaccine has been shown to reduce flu-related illnesses and the risk of serious flu complications that can result in hospitalization or even death. Personal protective measures: regular hand washing with proper drying of the hands, good respiratory hygiene covering mouth and nose when coughing or sneezing, using tissues and disposing of them correctly, early self-isolation of those feeling unwell, feverish and having other symptoms of influenza, avoiding close contact with sick people, avoiding touching one's eyes, nose or mouth. It's time to treat. Patients who are not from a high-risk group should be managed with symptomatic treatment and are advised, if symptomatic, to stay home to minimize the risk of infecting others in the community. Treatment focuses on relieving symptoms of influenza such as fever. The patients should monitor themselves to detect if their condition deteriorates and seek medical attention. Patients who are known to be in a group at high risk for developing fever or complicated illnesses should be treated with antivirals in addition to symptomatic treatment as soon as possible. Patients with severe or progressive clinical illness associated with suspected or confirmed influenza virus infection like clinical syndromes of pneumonia, sepsis or exacerbation of chronic underlying diseases should be treated with antiviral drugs as soon as possible. We have oseltamivir. Oseltamivir should be prescribed as soon as possible, ideally within 48 hours following symptom onset, to maximize therapeutic benefits. Treatment is recommended for a minimum of 5 days, but can be extended until there is satisfactory clinical improvement. Hope you learned something in this TikTok-y world, poof. I hope you've enjoyed my British accent, which I recently learned and practiced a lot for. Subscribe us, comment us, like us, kiss to your cute faces.